What are 3 business habits you can watch for when buying a dental practice? By business habits, I'm talking about specific qualitative markers, milestones you can be looking for as you look across the different practices you're thinking about buying to determine whether or not they're worthy of your consideration. As you're looking at dental practices, and as we at Dental Buyer Advocates look at practices, we tend to focus on the quantitative side. We're looking at numbers, we're looking at collections, overhead, how much are they paying for the facility costs and labs and supplies. But there's a whole other world of qualitative things to watch for that can be just as meaningful as the numbers. Another way to say that is the qualitative side sometimes feeds the quantitative. So what are 3 business habits that you can watch for as you're looking at different practices to potentially buy? The first is habits around staff. Specifically, does this practice have a regular process for compensating the staff? Yes, the staff is there to fulfill a mission, they love what they do, they're also there to get paid. I see most dental practices fly by the seat of their pants when it comes to things like reviews, raises, and bonuses. If you're looking at a practice that has a regular systematized process for finding, evaluating, and compensating their staff, you are almost certainly looking at a high-collecting, high-performing practice worthy of your careful consideration and potentially buying for sure. A very deliberate process for managing and compensating the staff means that that business owner, the seller you're buying the practice from, has been engaged not only in the staff side of the business, but elsewhere. That seller has probably created a culture of trust and loyalty in that office that's going to show both in terms of turnover with staff, but also how that staff relates to the patients, how happy the patients are to come into the office, how likely the staff is to take on new initiatives or do new things that can be valuable for the patients, for you as an owner. So how can you find out whether or not the specific practice you're looking at has good habits around the staff? This is an area of questions that is 100% on the table from the very first conversation you have with a seller. How they relate to, treat, compensate, maybe bonus their staff members is something that most sellers are more than happy to talk a lot about. And if you get any reluctance from a seller around talking about specifics around how often they give raises, what the culture is like, how often people come to them and ask for bonuses or raises, if a seller is reluctant to talk about those things, that tells you a lot about the likely culture you would be stepping into as a buyer. So ask questions. Ask questions of the broker, ask questions of the seller. If you can get in and meet the staff, ask questions of them too. Hey, when was the last time you got a raise? When was the last time you had a performance review? In that performance review, did you talk about your strengths? When was the last time you got positive feedback from the seller? These types of questions indicate business habits that are extremely healthy and something you want to watch for in a dental practice. Second habit to watch for, financial hygiene. Okay, I'm misusing the word hygiene a little bit here. What I mean is, does this practice have a process to keep track of the financials of the business on a regular basis? I mean clean financial records, tax returns that make sense, profit and loss statements that were easy to get and that make sense to, if not you, the accountant that you've hired to work through the transition. This is a very easy question to ask your financial representative as you're looking at a practice for sale. Just ask your accountant, hey, what'd you think of the financials? Were they good or were they bad? Most accountants can tell you very clearly if the financials were a mess or if, yeah, these are in pretty good shape. But some indications that might help you as a dentist is whether or not the seller was able to provide you that information quickly, whether or not the information was up to date. Depending on where you're at in the year, if you ask for a tax return in July and they still don't have it yet, that could be a sign that the seller is not very organized. It also could be a sign the accountant's not very organized, so just ask some questions. Good financial hygiene is important because it tells you how seriously the seller treated the financial side of their business. Were they a dentist first and a business owner second, or were they a business owner first and a dentist second? Neither one is necessarily right or wrong, but it's going to tell you a lot about the business that you might be stepping into. I like to argue that if the financials don't work, patient care doesn't happen. So I tend to think that business owner first, dentist second makes the most sense. but you can decide for yourself what you feel the most comfortable with. Either way, keeping track of the numbers and understanding what's happening with the financial side of the business is very important and a habit that you should watch for as a buyer. Habit number 3 is a marketing plan. Now, I'm being very generic here. Notice that I'm not saying specifically which marketing plan. By far, the number one marketing plan that I see in dental offices is no marketing plan whatsoever. It's crazy. The amount of dentists that just rely on a website and a sign outside their door is amazing to me. And what's even more amazing is a lot of those dentists, they're financially successful, and you might be looking at that business. If you are, and you can tell that there is no marketing plan, hey, that might be good news for you as a buyer. Let me get a little bit more specific on what I mean by a marketing plan. Some clues that I look for as a buyer's representative are things like the number of Google reviews, the quality of the website, whether or not money is actually allocated to advertising on a profit and loss statement or on a tax return. The numbers that I tend to look for are, in terms of percentage of collections, anything from 0 to 1% of collections means that that office almost certainly has no marketing plan in place. 1 to 3, 3.5%, 4% tells me that this office is allocating some money to advertising, that bringing new patients in the door is a priority, and they may or may not have an effective marketing plan, but at least they've got something in place. Anything over 4% of collections dedicated to marketing, and I'm asking some questions about how effective that money is being spent, whether or not, by the way, it's actually all marketing. Sometimes bookkeepers will throw personal expenses into the marketing category because they don't know where else to put them. But anything over 4% could mean that this office has a very robust marketing plan and they're trying to get a lot of new patients in the door. Again, could be good or bad depending on how you want to run your business. But you need to see whether or not this business has the habit of marketing themselves. Partly this is so important because I think this is a habit you're going to need to be a successful dental practice owner in the future. Chances are good you're going to be stepping into a practice either with a marketing plan in place that you're going to want to continue or tweak or change, or you're going to be looking at a practice with no marketing plan in place. And you're going to need to decide how important it is for you as the new owner to drive new patient growth, find the types of patients that you want to work with or do the procedures for. So look for a practice that has a habit of marketing and decide whether or not you have an opportunity as the buyer. So the 3 business habits you're looking for as the buyer of a dental practice are: number 1, a process around finding, evaluating, and paying the staff. Number 2, you want to watch for a practice that has a habit around keeping track of the financial side of the business in an organized way. And number 3, you're going to want to watch for a practice that has a habit of marketing, bringing new patients in the door to keep the schedule full and keep it growing. As you're looking at the quantitative side of the business, collections, overhead, labs and supplies, staff costs, all of those things are very important. But the business side, the qualitative side, there are a lot of things to look at there. Don't neglect them and watch for those 3 habits. If you'd like help analyzing the business habits of a practice you're looking at, be honored to help. Head over to dentalbuyeradvocates.com. You can schedule time directly with me, and I'd be honored to work with you. Best of luck in your practice search.